What if I told you that some foods that you eat might actually worsen your symptoms of Sjögren's disease? I see this in my clinic all the time. Patients that are trying to eat healthy, but they are unaware that some of the foods on their plate actually increase inflammation and worsen their dry eyes, their dry mouth, the joint pain and fatigue. So today I will walk you through the 10 worst foods for Sjögren's syndrome, from the least harmful to the absolute worst. And please don't miss the number 1, because it's something that you might be eating every day without even realizing it. I'm Dr. Girnita, a rheumatologist with more than 15 years of experience diagnosing and treating autoimmune diseases. Over the years, I've helped thousands of patients to reduce their symptoms and regain control of their lives through the most advanced medical treatments, as well as when I incorporated lifestyle changes, including diet. Why? Because what you eat matters. Digestion starts in your mouth and will continue to your stomach and intestine. But wait, if you are a patient with Sjögren's disease, then you know that the lack of saliva will cause more issues. First, dental issues. Remember, saliva contains some enzymes that will break down the sugars in your food, and it will protect the enamel of your teeth. But when you lack saliva, your teeth will degrade, you may develop cavities very quickly, and you may also lose teeth prematurely. Then second, the taste of the food can be changed in patients with Sjögren's disease. And third, because of the loss of saliva, you might have difficulties to eat dry foods like crackers without having to drink a lot of water, because you cannot swallow without saliva. Plus, people with Sjögren's disease might also have a lot of GI issues like heartburns, abdominal pain, bloating, diarrhea, and even constipation. And that's why you need to learn about the foods that are bad for you and those that you can use to replace them. And we'll start with number 10, red meat. Now, who doesn't like a good steak for dinner? I know I do. However, patients with Sjögren's disease might have difficulties eating tough meats because of their severe dryness in the mouth, the lack of saliva, and the poor dentation or poor teeth. If you are eating a steak or another type of tough meat, I do recommend cutting it into small pieces, chewing it very slowly, and drinking a few sips of water while you're eating. And reduce the quantity to 1 to twice a week. And always choose grass-fed red meat, because the quality of your meat matters. You should also try to replace it with more wild-caught fish that will bring you a lot of omega-3s that will decrease your inflammation. Anyway, fish is also softer and easier to chew and digest. You should cook the meat in a soup, because that's easier to eat and digest, or you should combine the meat with a sauce, because again, it will be easier for you to swallow. Now, before we continue, I wanted to let you know that I recently started a membership for my channel. So please consider becoming a member and support my educational mission, because you will get access to exclusive content before anyone else can see it. Number 9, fried foods. Let's talk about fried foods. Yes, those crispy fries, fried chicken, and crunchy snacks. I know they taste amazing, but here it is the problem. They are loaded with many fats. And these bad fats, because we call these trans fats, disrupt your gut health, which is already compromised in Sjögren's disease, and they will fuel inflammation and will worsen your joint pain and fatigue. Studies in animal models also look at the effect of high-fat diet and found out that the more fats are consumed, the worse the dryness in the eyes is happening. But what is a better alternative? Now, accordingly to this study, people who adopt a Mediterranean diet, they use baking instead of fried foods, use olive oil instead of processed seed oils, they have better control on their symptoms. But if you think that fried foods are bad, wait until you hear about the next one, because it's hiding in almost everything that you eat. Number 8 is high salt. Now, salt is everywhere. Processed foods, fast foods, and packaged snacks. They are all loaded with hidden salt. The food industry uses more salt because it enhances the food taste, and it is a natural preservative that will expand the food shelf's life. But did you know that too much salt can actually worsen the Sjögren's symptoms? High salt diets pull more water out of the cells, leading you to more dehydration, more dry eyes, more dry mouth, and even joint pain and swelling. Studies have shown that high sodium intake will increase inflammation and will worsen autoimmune symptoms. But how can you replace this extra salt and also flavor the foods? Flavor foods with herbs, garlic, turmeric, and ginger that will also enhance the taste and will have anti-inflammatory properties. And speaking of hidden inflammation, let's talk about a group food that many people don't even realize it's making them feel more bloated and it's causing diarrhea. Number 7, dairy products. Milk and cheese sounds harmless, correct? For many people, dairy is totally fine. But for many with Sjögren's, it could trigger more GI symptoms. Why? Because many patients with Sjögren's can have lactose intolerance, because the casein in dairy products can cause more inflammation in the gut. But what can you have instead? You can have almond, coconut, and oat milk. And if you tolerate yogurt, I do recommend plain yogurt or kefir, because it will bring you more natural probiotics and it will help your gut microbiome. Now, there are some drinks that millions of people are using every day. Yes, drinks that can make you feel good and more energetic, but there is a price that you will pay. They will cause you become more dehydrated. Now, do you know which they are? Yes, coffee, black tea, or energy drinks. If you rely on these drinks to get through your day, then you are making a big mistake, because they contain caffeine, which acts as a diuretic, meaning that will pull more water out of your body, exactly what Sjögren patients don't need. So drinking coffee or energy drinks will worsen your dryness in the mouth and will make you more fatigued. But what should you do to replace this? You should drink herbal teas like chamomile or ginger tea, or you should drink infused water with lemon, with cucumber, or mint. Now, this one might surprise you because it's found in so many healthy foods. Number 5, acidic foods. Tomatoes, citrus fruits, and vinegar-based dressing. They all contain citric acid, and we collectively call these acidic foods. You should avoid them as they irritate your mouth and they will erode your teeth enamel, and in this way will worsen your dental issues. But what should you do to replace them? You should swap oranges for low acid fruits like bananas or melons, and instead of vinegar-based dressings for your salad, you should add olive oil. Number 4, refined carbohydrate. Do you enjoy eating white bread, white pasta, white rice, or sugary cereals? Then my advice is to stop eating them immediately. Not only that they will raise your blood sugar levels, but they will increase your inflammation in the body and they will worsen the fatigue and the pain in your joints. So what are the better alternatives? Start eating whole grains like oats, like brown rice, corn, and quinoa, and have a 6-month trial without gluten, because many patients with Sjögren's disease are gluten sensitive. During this time, keep a strict diary of your symptoms and track your fatigue, your pain, your dryness. Don't expect to notice immediate results. Instead, track your symptoms to see if you see gradual changes. And if you see improvement, continue on a gluten-free regimen. But if you don't, then you may resume the foods with gluten. Number 3, processed foods. As a rule of thumb, I tell my patients that everything boxed is basically processed. Yes, even the famous peanut butter. From chips to hot dogs, from frozen meals to instant noodles, to pizza to hamburgers, from cereals to ice cream, all of these are processed foods. There is so much growing evidence that this type of food is full of unhealthy ingredients that will disrupt your gut microbiome and will cause more inflammation, leading to an epidemic of chronic conditions from diabetes to heart disease to autoimmune diseases. And that is why I strongly encourage my patients to cook at home with fresh ingredients. Make a soup or a stew in a crock pot, or just chop some veggies and eat them with hummus. Try to eat fresh fruits and vegetables and stay away from processed foods. Now we are down to the top 2 worst foods for Sjögren's disease. Number 2, alcohol. Yes, alcohol dehydrates the body, decreases the salivary gland function, and causes more dehydration, which will exacerbate the symptoms in Sjögren's patients. And it will also interfere with the absorption of certain medications. So drinking more than 1 glass or drinking heavily, like hard liquor, can cause gut microbiome alteration, can create inflammation in the gut and leaky gut. It will disrupt also your sleep, and it will increase inflammation because the markers of inflammation will be increased in people that drink heavily alcohol by 30%. What are the good alternatives? Start your day with a glass of water, which is infused with fresh fruits, and why not a green smoothie? And I mean a real green smoothie that will incorporate fresh or frozen fruits and not powders that will mimic smoothies. And now, the worst food for Sjögren's patients is sugar. The average American consumes 57 pounds of sugar every year, which is 10 times more than 100 years ago. And most of us, we eat 300% more sugar than it is recommended. And we all agree that sugar is tasty, but unfortunately, sugary foods can cause insulin spikes, making you more hungrier. Sugar is the ultimate enemy for patients with Sjögren's disease. Why? Because it will increase inflammation, will disrupt the gut microbiome, and will dehydrate the body. A long-term study showed that high sugar consumption increased the risk of developing autoimmune diseases and exacerbates symptoms in those that already are affected. And there are many hidden sources of sugar, like breads, pastries, sauces, healthy breakfast cereals, and many energy drinks and juices. Now, what should you do? Should you replace the table sugar with sugar-free foods? That sounds good, correct? But unfortunately, these sugar-free foods contain artificial sweeteners like aspartame or sucralose, which disrupt the gut bacteria and will increase inflammation again. And aspartame was also linked to cancers and more autoimmune diseases like rheumatoid arthritis and Sjögren's disease. You should choose natural sweeteners in small quantities, like honey or maple syrup. But even better, you should start training your taste buds to enjoy less sweetness overall. You should start replacing sugary snacks with fresh fruits like berries or melons because they contain many antioxidants and they will hydrate your body. In a few weeks without eating sugar, you can decrease inflammation, you can increase your energy levels, and you can reduce fatigue and joint pain. And now that you know these 10 worst foods for Sjögren's disease that make your disease much worse, it is time to learn the best foods that will help you decrease inflammation and thrive and not only survive. And you can find this information in this video.